Let's talk about some techniques for treating neck and face pain with or without a migraine, because you could have neck and face pain prior to having a migraine, and we can treat it before you even get there. When you have neck pain with face pain, the first step is to pay attention to where your head hurts, because this is very good information. For example, if you're hurting in your jaw and your cheeks, then we know specifically where the pinch is. If it's behind your eyes, we know specifically where the impingement is. So we need to pay attention to where it hurts, and then pay attention to that on an ongoing basis so you know, oh, okay, when my face hurts here, I just simply do this. And I'm going to show you a bunch of the things that you can do to make it better. Anytime your face hurts in the type of way that causes migraines, it is because there is a pinch near or in the trigeminal nerve, the nerve root, or the blood vessels and arteries that are around that area, which is right by the jaw and the jawbone that moves. We saw the pictures for that in week 4 overview, and you can revisit that video if you want to see where the trigeminal nerve is. Now, to eliminate the pain, we're going to talk through this video about super relaxing the jaw and the neck muscles, because that's where the impingement is that's cutting off the circulation. Now, alignment may also be an issue, because most of the time whenever you have face pain, it signifies your tight jaw, your tight neck, which could signify your neck is out of alignment. Now, the first step is going to be relaxing your face and your jaw. Very critical. And this slide will just show you some of the ways that you can talk to your face and let it be calm, and talk to your jaw, okay? So all of these movements are super, super gentle on the face. Even if you have a lot of pain and you just want to dig in there and push hard on the face, I don't recommend that. In most of the areas, your face is kind of tender. So I would just do these nice, gentle, circular motions that are shown in the slide. And we're going to show you some other ones where you just run your fingers over your face and you're really communicating through the skin that you want everything to relax, okay? So you're going to do these type of exercises. Put your hands right now just over your eyes and over your temples, and just gently pull your hands away from your face and do that stroke a few times, kind of like you're petting your eyes and petting your face. It's very calming, and this is something that is going to help you a lot when you have any type of face pain. And there's a lot of things we'll be doing. This won't be the only step, but this will be one of the steps to help. Now, this video, I'm showing this because I got this from the MELD method. This is a therapist who came up with a way to do face exercises for her patients, and she found out that it actually lifted their face. They got a little facelift after doing these exercises I'm about to show you. And you can find out more about the MELT method at meltmethod.com. I'm referencing an article from the New York Post with Susan's MELT method. This little ball is one of the ways she uses it, but you can also use the hand, your fingers, instead of this little blue ball. You place your left hand or the ball behind your earlobe at the base of your skull. I cannot tell you how valuable this is, okay? So do try it right now. Now you're just going to use your fingertips and gently and uniformly put pressure where that is, right below the ear, and do little circles for about 10 seconds, about 15 circles. And then when you're done with those 15 circles, just stop and press gently in that area like you're squeezing fluid out of a sponge. Hold that for 2 breaths, then release it. You're going to do that on both sides. Then you're going to move the ball. This is just slightly different. If you see where her ball is located, it's in front of the ear. Move the ball there, keep your head tilted, and place the ball or your hand under the cheekbone at the temple. This is right at the joint where your jawbone opens. Now, if you open and close your jaw, you'll be able to feel that little bone moving. You're going to put it right there. Move the ball or your hand in circles for about 10 seconds, 15 circles again, and then press and hold for 2 breaths like you're squeezing a little bit of fluid out of there before you release. Then you're going to do the movement now with your head still tilted, and you're going to put it at the temple and do the exact same thing, pressing little circles for about 10 seconds. You can do this while you're listening to the video. Do the little 15 circles, gentle, and then hold for 2 breaths. All these areas we're talking about have things that can be moved around, so we don't want to put too much pressure, or we could actually do something we don't want to do. Be sure and do it on both sides of your head. The last step feels so good, and it really does relax the face. So let's do this together. Use your fingertips to create feather-like sweeps to rinse your face and neck. Okay, so you do 3 or 4 sweeps for each area. First, we're going to brush the collarbone a few inches forward toward the chest. Okay, just brush it toward inside the chest, towards the center. Then sweep downward from the outside of the throat near the collarbone, making a little V under the neck. And then start from behind the ears and sweep to make a horseshoe shape on the outside of your neck. Okay, a horseshoe shape on the outside of the neck, on the side of the neck, you know, like down your side, over by your shoulders. Then brush your fingertips from underneath your eyes towards the jaw. Oh, that feels good. And then sweep from the forehead out toward the temples, right? And that feels really nice too. And if you just do this lightly, it's just like, it's very soothing. Continue that same motion, moving down the forehead to the collarbone. And then finish by brushing the front of your face between the brows, over the nose, lips, chin, down the center of your throat. Basically, you're doing these nice sweeping movements in a more of a straight pattern than that first slide where we do a lot of circular motions. You can do all of the ones that feel good to you. All of these nice light touchings of the face actually stimulate collagen, lift your face, but also they soothe the muscles. They help with circulation of those nerve endings and the blood circulation, which helps get the circulation you need to the face and the neck, which is part of the reason why we're getting migraines, is this not enough circulation. Okay, and then to protect your skin, always be gentle. Do not pull on your face. Relaxation does not have to be hard. Okay. Now there's also these great facial exercises and massages you can do that are, there's hundreds of them actually. What you're doing is twofold. You're bringing your awareness to your jaw and your face, see, along with the circulation and the nerve flow. This is a conscious relaxation. And so while you're doing it, don't just think about all the things like, oh, I got to do this exercise, then I got to do this one. Just gently stroke your face in lots of different ways while you keep your jaw relaxed. And your tongue relaxed, okay? Those are really important. Now, this little exercise I liked, she pinches her chin. So you pinch the end of your chin and then you pull your fingertips out like a snap and you go up your jaw and you snap it out. And this is another way to kind of relax the jaw. There are lots of great jaw relaxing exercises and I'm showing several throughout this course, but getting the jaw relaxed is absolutely critical because the jaw is where a lot of the trigeminal nerve roots and the basilar artery, all these different things pass through there, and we need the jaw relaxed in order to get the right amount of circulation to the face and the head. Tension, totally our enemy. When it comes to stress, tension is the worst thing. And combine that with heavy physical demands or poor posture or neck misalignment, and you are on your way to get a migraine. I have some videos specifically addressing alignment of your neck and spine and how you can do things at home. But sometimes, let's face it, sometimes we need extra help. Of course, rest, hanging upside down, deep relaxation, and lots of things that you can do at home will help your neck relax. But sometimes we just need extra help. We need either an osteopath, chiropractor, craniosacral adjustment, or physical therapist. I like physical therapists that also does soft tissue manipulation. I learned how to fix my neck from my physical therapist. If you need to find a physical therapist, then do some interviewing. Don't just go to anybody who's going to work on your neck because not everybody does a technique that's gentle. You don't want to overstretch the ligaments at the very top of your neck, and you want to have adjustments that are less invasive. And that's why I like my PT, because the way he adjusted my neck, I learned how to do it myself. And now I don't even have to go see somebody because I've learned how to hold my posture right and get my neck in alignment if it gets out. These are some of the techniques that I do at home, and I would highly recommend for you to do it to align your neck yourself. Absolutely relaxation. Nothing could be better than relaxing to get the muscles into the right position and get them relaxed so that the spine can align. Deep breathing. We all hate to hear deep breathing, deep breathing, deep breathing. We all hate to hear that, but it is like it's the fix-all for everything. If I have anything going wrong, all I have to do is get my breathing to a total relaxed, deep state where I'm breathing really slow and kind of effortlessly, but deeply. Boom, everything's fixed. Deep breathing is the biggest magical thing that we have to use to heal our bodies. Of course, massage. Who doesn't like massage? That is a really good way to relax the muscles so that the spine can naturally go back into alignment. Stretching, working on our posture. I do a little posture exercise in the mornings just to remind my body what my posture is supposed to be. And then I'll check and do that throughout the day because I've had terrible posture, so I've had to remind myself a lot. That's a really key thing that's helped my neck so much. And then strengthen our neck and back muscles and our core muscles. Yeah, this is something I learned the hard way. When I first saw my physical therapist, I had no idea that since I fell off a ski lift when I was 14, that since I dislocated my hips, I have been standing incorrectly my whole life, since I was 14 years old. And he showed me how to put my hips over my legs so that I didn't tilt forward. I actually was standing up straight, but I had been doing it wrong for so long that my hip flexors were shortened. So I couldn't even stand up all the way straight without pulling these muscles. So I had to do stretches to pull those muscles right. I mean, I've been standing wrong my whole life. As I've been improving my posture, huge benefits to my physique, my muscle structure, and less pain. Highly recommend it. Strengthening those muscles will help a lot. Ergonomics at work, I've been doing that for years, where I try as best I can to have an ergonomic desk set up, and I've showed pictures of that in videos. Relaxing the jaw. And you know, the relaxing of the jaw made a big difference the more I did belly breathing. Without belly breathing, my jaw tended to get tight all day long and all night long. Had to really get my breath calm to keep my jaw relaxed and my posture, because like I've said in other videos, when your posture is out of alignment, your jaw will actually tighten to help stabilize your neck. So if you're out of alignment, you're going to have a tighter jaw regardless, most likely. And then trigger point release. This is where you find a spot on your back or your neck that hurts really bad, and you press on that spot that hurts. Oh, you press on it, and it hurts so bad while you press on it. You do it for 1 minute, and then you release. And what it does is it gets blood circulation to push into that muscle for a minute. And you do that a couple times, and it actually releases the trigger point. Because what trigger points are is an area of a muscle where the circulation has been cut off. And what you need to do is get that oxygen back in, that circulation back into that particular part of the muscle. I am promising you that most pain is simply lack of circulation. I am promising you that most pain is simply not enough circulation of blood to a certain point. If we have nerve and blood flow, we don't have pain. So let's get that nerve and blood flow up. Qigong, excellent way to get nerve and blood flow. These gentle little breathing exercises and movements help stimulate circulation. Of course, the neck exercises, I have videos that show the neck exercises so you can learn them yourself if your PT is okay with it and your doctor is okay with it. I learned these neck exercises from a physical therapist. And then gentle movements throughout the day, because we cannot function if our spine is not moving. If you don't move your spine throughout the day, you are going to have neck and back pain. I just can't emphasize that enough. Movement, movement, movement. Even if it's gentle, even if it's walking, even if it's twisting side to side, just little gentle movements throughout the day. Immobility is the enemy. It is up to you to care for your spine, to protect yourself from neck and back pain and migraines. If your neck is involved in your migraines, then this whole week is so critical. It will teach you how to care for your neck, how to avoid the pain, how to treat it when you do have it, and eventually you'll get yourself in a space where your neck is feeling better, your jaw is relaxed, you're breathing the way you're supposed to be breathing all throughout the day, and you're going to feel great. And you're going to have a lot less pain and a lot fewer migraines, and eventually no migraines. So watch all the videos in this week. Thanks.